Welcome to another edition of the Borno Health Update. I'm your host, Ibrahim Amarawa, here to shed more light on the remarkable strides being made in our healthcare sector under Governor Zulum's visionary leadership. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. The contributory healthcare scheme in Borno State is crucial for improving the health and well-being of the citizens as it directly tackles the major financial barriers that prevent people from accessing medical care. Its importance is particularly significant for the state's large vulnerable population, which has been affected by over a decade-long insurgency. In his address during the opening ceremony of the 5-day sensitization workshop for the formal sector scheme, the Commissioner for Health and Human Services, Professor Baba Malamgana, articulated the administration's strategic reform led by Governor Zulum to transform the healthcare sector. The central goal of this initiative is to provide citizens with seamless access to essential healthcare services.
This event today gives me a great honor and privilege, and I'm very delighted that we are celebrating a milestone today. On behalf of His Excellency, Professor Babagana Omarazulum, CON, MNI, FNSE, we formally today welcome the formal sector into the insurance policy or contributory agency policy today. And today's what we're doing is sensitization on the commencement of the formal sector, which is very crucial. You have already heard from so many people, especially the Executive Secretary, who made an erudite presentation, and I'm sure most of you have understood the importance of this, what we're doing today. I want to highlight that under the leadership of His Excellency, the Executive Governor, the health sector in Borno State has made remarkable progress. From primary health care to secondary health care facilities to tertiary health care, Borno has moved from leaps to bounds. This year alone, under His Excellency, we have seen renovation, revitalization of 100 primary health care centers. We have seen the commissioning of eye and dental hospitals in the northern parts, in Monguno recently, and eye and dental hospital in Biu some few weeks or months ago. They are all functional, and as a matter of fact, His Excellency has declared 5,000 free cataract service both in Biu and Monguno, and is ongoing. You may be aware that His Excellency in 2023 declared free maternal drugs. His Excellency is doing his utmost best to ensure that maternal mortality should be crushed. We have recently introduced the State Emergency Medical and Ambulance Services, SEMSAS, with a toll-free number so that a woman in the middle of the night, 2 o'clock in the morning, If she starts bleeding, for example, she can call this number and the ambulance will come to her house. This is what you people have seen in the past in countries like England, where ambulances can be called through a toll-free number. This has, alhamdulillah, now reached Borno State. We appreciate His Excellency for this innovation and bringing this, especially to reduce the maternal mortality. All these achievements, including the recent commissioning of the College of Nursing in Monguno and the College of Nursing in Goza, are testament that His Excellency is repositioning the state in such a way that the state will not suffer from the chronic, acute upon chronic shortage of manpower. Furthermore, very soon His Excellency would commission the tertiary center, our flagship, the Kashim Ibrahim University Teaching Hospital, and the medical school here in Maiduguri. Students have already been admitted, and the building itself is almost finished, and all the equipment that are necessary, almost all of them are here, and therefore commissioning will be very soon. We wait for His Excellency to give the nod so that it could be done.
The Commissioner, while appreciating the support of the Borno State House of Assembly House Committee on Health, enumerated the benefits of the contributory healthcare scheme to the civil servant and urged them to give maximum cooperation to achieve universal healthcare coverage.
His Excellency graciously approved the 3.5% civil servant contributions after a lot of behind-the-scene discussions which we have participated, and let me appreciate the Chair House Committee on Health for his contributions as always, not just in this aspect, but for many things that's happening in the healthcare sector in Borno State. So as enumerated earlier, the total contribution will be 10%, and that's a game changer. So that your families, your children, mostly women and children, are the 70% that come to our hospital. They will now enjoy, excellent care, and you have the right to change the facility if you are not happy. This formal sector commencement is designed to guarantee civil servants and their families to access affordable and quality health care. Also, it reduces the financial burden as presented earlier on, out-of-pocket expenditure that our people have struggled with as a result of healthcare delivery. It also would strengthen our healthcare system because all the hospitals will now be focused on ensuring that quality of care is improved when you come to see them. And the Borno State is aligning itself with global commitments, particularly SDG, which has already been shown to you earlier on. And by so doing, we're ensuring that healthy lives and promoting well-being is at our utmost step. So it is important in this workshop that you as civil servants are the first to be informed about this formal sector, and we need your cooperation to ensure the success of this. You will not know the importance until you fall ill. Countries like United Kingdom, from birth to death, the healthcare there is free completely. And that is through contributory agents.
That was Professor Baba Malam Gana, the Commissioner of Health, enlightening civil servants on the benefits of contributory healthcare scheme. Similarly, the Executive Secretary of the Borno State Contributory Healthcare Agency, Dr. Abbas Saleh Kada, informed the participant the rationale behind the creation of the agency, as well as the function and advantages of the contributory scheme to the civil servants.
So my presentation is just an overview. The Borno State Contributory Healthcare Management Agency was assented by His Excellency Professor Umar Azulu, Babagana Umar Azulu, MNI, FNSC, and CON on the 15th of August 2019, and the agency was established on the 24th of January 2020. The mission for this agency is ensuring universal health coverage through an improved healthcare financing and to aid in achieving health target of the Sustainable Development Goal. And the mission is actually wellness for sustainable development. Without health, we cannot develop. And more importantly, we have this demographic health index, which is actually very important to all of us. The maternal and child mortality and morbidity is among the highest in Borno State. In fact, in the country, as a nation, we are second highest in terms of maternal and neonatal mortality, while as a country, we are number 3 in maternal and neonatal death. So this kind of activity is here, or this kind of scheme is here to see how we are going to reduce the maternal mortality burden in the state and the federation at large. And the level of poverty index, which was actually mentioned by one of our key speakers today, is that we have our multi-demographic poverty index is as high as 70%. Borno State has over 70% in terms of that. Such is to say, out of every 10 individuals randomly selected, 7 of them are actually living below poverty. And one of the causes of poverty is actually health. Also, the level of catastrophic health expenditure sometimes is as high as 80% at the state, and the national average is as high as 60%. And we also want to look at if we have done something about the health insurance, which is actually one of the safety nets to reduce poverty. The World Health Assembly resolution in 2005 urged countries to develop their health financing system to increase universal cost for attainment of universal health coverage. And universal health coverage can never be achieved with out-of-pocket expenditure. So the global drive to ensure all people have access to needed services without the risk of financial hardship linked to paying for care, and who pays for that care. The National Health Insurance Authority and the state social health insurance authorities are the approved institutional structure to facilitate contributory healthcare financing mechanism. You can see the health is actually central to the Sustainable Development Goals. If you can see, goal number 3 is talking about universal health coverage by ensuring all people have access to needed key promotive, preventive, curative, rehabilitative health services for good and quality at an affordable cost without the risk of financial hardship. What are the advantages of contributory health financing? One is the health insurance or contributory financing has become a global option for funding healthcare services, and it eliminates both physical and financial barriers to access healthcare services. You don't need to have money to go to the hospital. And significant equity in social health, income-based contribution, whereby the people in the higher part of the ladder are the ones that are supporting the people from the lower part of the ladder. When we mention 3.5% of basic salary, the 3.5% of head of service is different from the 3.5% of the junior worker in his office. So thereby, it is the head of service that is actually subsidizing the health care for the lower cadre. And we are now when we started this program, we invited the people within the health institution, because based on the analysis that we have done, those people that are working in hospital management, both primary health care and others, and Ministry of Health, are the highest contributors of this scheme. Then also, it provider purchaser separation to ensure effectiveness and efficiency. When we say provider separation, is that in the olden days, what we have is that the health cost is being subsidized and everybody goes into the hospital, and if the care is available, you receive it, and if the care is not available, then you have to look for money to receive the care. But in this case, there is actually separation between who is funding the health and who is actually offering the services. That is the supply and demand mechanism. And it also have good prospect for wide coverage and risk pooling, typical of to ensure sustainability. What we are saying here is that while we are doing the enrollment, we give the people, all the civil servants, we give them the choice to choose which facility they want to be enrolled in. We are not going to force you or box you into you must go to this facility. By providing that option, then the facilities also have to compete so that they now upgrade their game or upgrade their services so that more people will be coming to them. And we'll also be giving you option to change facilities as at when due. When you feel that this facility is not favoring you, you have the right to also change that facility to another facility. So by doing that, we are now putting the facility on a competitive mode.
Another important life-saving aspect in the healthcare sector is the provision of ready-to-use therapeutic food RUTF to tackle the issue of severe acute malnutrition, which is bedeviling the state. The Borno State government, in collaboration with the UNICEF, recently purchased 1,000 cartons of RUTF, but some miscreants tried to undermine this effort. However, the security agencies are not sleeping. Recently, the Rapid Response Team, with the support of the Anti-Social Vices Squad of Nigerian Police, Borno State Command, confiscated over 10,000 pieces of RUTF and handed them over to the State Health Commissioner. The Deputy Commissioner of Police, DCP Babalola, emphasized that the perpetrators had been charged to court.
It's based on rejuvenated rapid response squad and anti-social vice unit, anti-social vice unit, recently rejuvenated by His Excellency Professor Babagana Marazulu, where they equip us and empower us to ensure crime and criminality in Borno State is bring to the barest minimum. And on that, we conducted continuous raiding, stop and search in various locations to ensure no any criminal is moving anything or do anything against the law. So in the process, we intercepted this very ready-to-use therapy from the people loading it out of Borno State. Meanwhile, they are trying to suffer the children of Borno, and then in view of that, the police will not tolerate, most especially the RRS unit will not tolerate anything to happen to the children, and we are there to protect life and property. We arrested 2 people. From them, we recovered about 3,314 pieces of this very tamwa from one vehicle. Another one, we recovered 4,557 pieces of this ready-to-use therapeutic food supplement. And then in view of that, we took them to court under the command and control of the Attorney General and the Commissioner for Justice, in which within 1 week, then they were tried, and then the court give judgment that those people should be convicted, in which they have been convicted, and then the item recovered from them is being handed over to Ministry of Health on behalf of Borno State government.
Of receiving the items, the Health Commissioner commended the police for their efforts in recovering the RUTF and assured them of collaborations in ensuring that this important commodity reaches those who are in need, adding that the RUTF is mainly for malnourished children. pregnant women and lactating mothers.
On behalf of the people and government of Borno State, led by Professor Babagana Umara Zulum, our executive governor, MNICON, I would want to today appreciate and always appreciate the Borno State Police Command. The police have at all times provided security to the entire people of Borno State, and we appreciate them dearly. We have also worked with the police in terms of social vices, miscreants, and I'm very pleased that today we are seeing the results of one of the efforts of Borno State Police Command, where some miscreants were arrested when they stolen the ready-to-use therapeutic food products, and we are going to go away with them. These food products are meant for treating and prevention of malnutrition, especially in children under 5, and also pregnant and lactating women. These food items are very critical and very valuable. As a matter of fact, any child who has developed malnutrition before reaching 1,000 days of life, if he has malnutrition, he will have some long-term mental implications. So therefore, it's incumbent upon us and the general public, to whom we are grateful, that supplied information which has led to arrests of such people. And also we appreciate the Commissioner of Police and the Commander in their efforts to keep us safe and secure in Borno State. On behalf of the Minister of Health, I most profoundly want to thank them for this effort. And I want to assure them that with me in the team today is the Executive Secretary of the Borno State Drugs and Medical Supply Agency, who will take immediate custody of this, and eventually it will reach the rightful people through our system. So I would like to thank you so much, Commander, for arresting the people, prosecuting them, and also today handing over these products. Would like to also appreciate Ministry of Justice in their effort to ensure the speedy dispensation of justice in this situation, and as always, therefore we are grateful that these people have now been prosecuted. Thank you very much, and we're looking forward to working with Borno State Police Command at all times, and we are open whenever the need arises. My telephone is open 24/7 to the Borno State Police Command, so that we can work together to overcome the problem.
In an interview at the police headquarters, after receiving the items, the Health Commissioner issued a stern warning that any staff caught stealing Arutayab will face immediate dismissal and criminal prosecution. This warning also applies to any individual who purchased the stolen supplies, and they will likewise be subjected to legal action. Thank you for joining us. Stay tuned for the next week episode, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa, reminding you, health is wealth, and Borno is on the rise.